Hi, good evening. This is Mohammad Mamunalum, is superintendent pharmacist for Woodbridge Road Pharmacy in Ipswich. Today, we decided to do a mental health live program for people who is in need. And as we know, in the UK now, we have 1 in every 4 people suffering with some sort of a mental health problem. Now, as a pharmacist, as a community pharmacist, locally we thought we can help you some people. Like we see people every day who come to the pharmacy to collect their medication. So my job as a pharmacist is not just prescribe the medicine. We are in very good contact with people who come into the pharmacy for medication. So we understand them and we see how they're suffering with some mental health problem, people who came before, and also how their mental health problem is progressing. So, and today we have here with me as a guest is Mr. Graham House, who got very good experience on the mental health issue, and he will be talking about as a hypnotherapist how we can help people. So I'll pass the phone to him, and he will just will take you there.
Good evening. I'm Graham Howes, and I live in Ipswich. In fact, I'm just down the road from Mohammed, and I'm a professional hypnotherapist and have been for up to 20 years now. Just a little bit about my background and how I got into this. I was an actor and still am involved to some extent in the theatre world, and around 20 years ago, I was in a show called Fame, and I looked around and I could see that a lot of my colleagues were suffering from things like anxiety, depression. They were being told by the choreographer, you need to lose some weight, you've got to give up cigarettes, you've got to stop smoking the wacky backy and get the alcohol under control. And some were getting nervous and some were having difficulties with auditioning, stuff like that. So I started to train then, and long story short, spent some time doing Sunday clinics in Harley Street, and eventually left London altogether and ended up coming to, a long roundabout way, ended up coming to Ipswich and establishing myself here. And so ever since then, when I started 20 years or so ago, my practice has just got broader and broader, and I think in lockdown at the moment, the 3 things, well, actually 4 things, because one of my neighbours mentioned this to me today, the 4 things that seem to be affecting people particularly badly at the moment are anxiety, depression, and stress, and also in some cases panic attacks. And obviously I'm seeing a lot of people like I'm talking to you now online, because I can't sit in a room with people. I'm forbidden to do that, as are many other therapists at the moment. So I want to talk a little bit about the subject of anxiety, depression, panic, and stress. There was a wonderful sage called Lao Tzu, and he said, if I can just read it, if you're depressed, you're living in the past. If you're anxious, you're living in the future. If you are at peace, you're living in the present. Just to unpack that a little bit, depression, for instance, depression is absolutely real. I know that sometimes people think that it's something that people put on. It isn't. It's chemical. Some of it is diet related, but there are also elements of it that a hypnotherapist can deal with on 2 fronts, and I will unpack that a little bit more as we go on. Generally, the approach at the moment, and I'll ask Mohammed, the pharmacist's sort of view on this in a moment, is pharmacological. So people are given drugs, antidepressants, and that sort of thing. The only issue with that is it can be excellent short term, but for instance, I had a client who had been on Prozac for 10 years, and basically she just needed some anger management. Once we sorted the anger issues out, she seemed to be an awful lot better and more in control of her life. So anxiety, oh yes, another thing about depression is that there was a wonderful series, I don't know if people saw it on BBC TV a year or so ago, when a doctor tried to persuade some people in a doctor's surgery instead of antidepressants to prescribe things like yoga and exercise, and he took on some of their patients and had some success with doing that rather than antidepressants. So it's just something that is worth looking at. Anxiety is when we worry about what is going to happen, and then we catastrophize it in some circumstances. So, such as if we park on that double yellow line and when we're nipping into the newsagents, we might worry that we're definitely going to get a ticket. Whereas the optimist is more likely to say, well, maybe I'll get a ticket, but if I look up and down the road and I'm quick, then maybe I can get in and out and without getting a ticket. Not that I'm suggesting people park on double yellow lines, but I hope you get my drift with that. It's all a question of how you think about things. And certainly one of the things that I do as a hypnotherapist is try to get people to reframe, to look at things in a more positive light, rather than always thinking that it has to be the negative approach. My way of helping people is to enable them to face whatever the challenge is and deal with it, rather than getting too anxious about it. Again, we can talk a little bit more about that as we go on. Panic is when anxiety kicks up a notch and goes into overdrive, and I'll explain why that happens in a moment. Stress is, I always think it's a bit like a family-sized pizza. You can't shove the whole family-sized pizza in your face all at the same time. So the best way to deal with it is to chunk it down into bite-sized pieces, or slices, and it's the same with stress. If we have a number of tasks that we need to do, there's no point in trying to do 25 different tasks and expecting them all to turn out well. They're not going to. So it's always better to prioritize and chunk the task down into manageable chunks. So all of these things that I've just been talking about are interrelated. So that's in my view anyway. And I think they're based in our old friends fight, flight or freeze, which may be a concept that you're familiar with, or maybe not, but I'll explain anyway. There's a bit in the brain called the amygdala, and it's one of the most primitive forms of the brain. It's basically all about how we survive. So, if we had a tiger running at us when we were a primitive person, just sort of a hunter-gatherer kind of person, it was not a good idea to go, hello, Mr. Tiger, because you're going to be their breakfast. So basically we would either run away from it, that's the flight bit, fight it if we possibly could, or pretend we're a tree and hope it doesn't notice. I'm being frivolous, but those are the three sort of ways that we would deal with danger. The way this translates into 21st century is interesting, because if Nigel from accounts comes up to you and says, there's a bit of an overspend on your accounts this month, then it's not a great idea to knock Nigel down, run away from Nigel, or pretend you're a tree. It's not gonna work. So we tend to suppress or repress that feeling. Unfortunately, the unconscious bit of us, the subconscious bit, then thinks, what's the matter? I just gave you some adrenaline to deal with that Nigel tiger. What are you doing? Have some more. And suddenly you're awash with more adrenaline. And in a short while, it all gets terribly out of control, and we're in a position of anxiety, stress, or even panic if it carries on. by which point we're hyperventilating and we feel like a gibbering wreck, and that's not great. And that's why anxiety, panic, and stress are so distressing, because they are so awful. I mean, again, I'll ask Mohammed in a moment about that, but again, often people are prescribed things like beta blockers to deal with that. Whereas I feel that with a bit of careful training, we can learn how to handle the anxiety, how to handle the stress, how to handle the panic by a combination of techniques, which I will demonstrate later for anybody who is interested in learning a simple technique. I'll do that at the end of this, though. Yes, go on, Mohammed.
Okay, thank you, Graham. Now, from Graham conversation, we learned really mental health issue is not always about the treatment. Is you need to find out who is causing the problem. So we need to trigger on the causer, not just treatment. Because as you see from the prescription and the prescribing system in this country, doctors do prescribe the medicine once they know you have the mental health problem. But the real term is not all this medicine working for your mental health problem. Sometimes it's also evidenced the same medicine used for the mental health treatment is similar to a placebo. Grimes said, okay, let's not just go into the goal. I mean, what happened from your anxiety, from your depression? Let's find out what is triggering your problem. So that's his mention. I think this is very, very important, because if you go to the doctor, yes, they're going to write a prescription after assessing your mental health problem. But to go back to your root cause analysis, okay, why I'm having it? Let's work on it. That's, I think, we need in the society at the moment, because as you see, the number of population suffering with anxiety, with the depression is really, really alarming. It's 1 in every 4 people in the UK with some sort of mental health issue, either anxiety, depression, or any from it. Now, as a pharmacist or as a hypnotherapist, what we thought, I think it's quite similar, because in the pharmacy, what we are doing at the moment, we are dispensing every 3 or 4 prescription is for mental health. So it is alarming for the NHS, for the society, for the country. So I think it's lots of people out there to help you. So, and where you can get the help, go for it, because the evidence is there. Sometimes the cognitive behavior therapy is working better than all this medicine on the prescription. So we need to be careful about it, okay, how we can sort it out. And also Graham was mentioning about the prescribing of depression medicine, or for the anxiety. He was also mentioned about the beta blocker. Yes, there are some medicine also given to the patient as a prophylactic help with the anxiety. Now, question is the medicine really working well? And also the medicine has side effect. The medicine has effect on the heart as well. So that's why now people are looking for, okay, let's find out how we can deal our anxiety, our depression with cognitive behavior therapy, with the physical activities, with diet. I think it's coming into the main treatment, main stream of our treatment, to being how to get better with the mental health problem. So, and Graham already talked about all this hypnotherapy. This is hypnotherapy. I didn't know that much about as well. So when we invited him last time, so there's it's much more to learn, and it's easy process. He can show you the techniques, how can deal with it, and how can improve your mental health. So let's help each other and to learn from each other, learn the techniques to improve our mental health. And also something, Graham, I have to mention, like with the COVID-19 pandemic, we have UK more than 500,000 more people are affected with this mental health issue. And maximum, mostly, they're within the high risk people, like people over 65 and people who are on some other medical condition or some medicine they're taking. Because this pandemic, the COVID-19, is affecting everybody, but it's mostly affecting people who got some other medical problem, high risk people like asthma, diabetics, and cancer patient, and also aging population. And this is the main people who've been affected mostly and also died from this coronavirus. So it's quite obvious these people would get more mental health issue. Now, NHS also made some recommendation. We'll talk about in those in a second. So I have a few questions before I go back to the question. Also, all this audience who is on live, I know it's a bit late for many people who might be going to the bed, but still, if you have any question, you can write on here on the chat box, and where we can see those, then we can answer to your question. So first of all, my question to Graham. Now, you have talked about this the hypnotherapy.
Yeah.
And can you classify how you can classify them, like either analysis or the suggestion therapy?
Right. It's different from CBT and counselling, which are very good for certain things. Hypnotherapy is more about helping you modify your behaviour. So it's what we call brief therapy. It's all about trying to help you to modify your responses. For example, learning to drive a car is a great example, because at first it seems very bewildering. We get in the car, it seems we've got to do so many things with our feet, our hands, and it seems really difficult. But after a few weeks, we learn it unconsciously, which is where all the action is, by the way, because it can do around 4 million things every second. Is running your body, your brain, your thoughts, and etc. Pain, everything. The conscious mind can do only between 5 and 9 things per second, but I can guarantee if I asked Mohammed to pat his head, rub his tummy, sing a song, and do a math problem, he would probably go, I have to stop doing one of those things. So that's a benign habit that we learn. What is not a benign habit is when we think, I'm anxious, I need to have a cigarette, I need to self-medicate in some way, or I need to get very anxious, and we really start to suffer. So hypnotherapy helps you to examine, exactly as Mohammed said, why this is happening. Because you actually unconsciously know why it's happening, otherwise it wouldn't be triggered. So we actually pretty much ask the unconscious, what's going on here? Why is this happening? We then sort of suggest to the unconscious, well, yeah, okay, I know in the past you reach for a glass of or 2 or 3 of wine to sort of address your anxiety, stress, depression, but actually is that the best way forward? There are lots of other things that the unconscious could learn to serve up as alternatives to that, which helps long term. Hypnosis is basically just a fixation of attention. It's nothing weird and strange. You're not dancing around with elves, in Never Never Land. You're not doing the funky chicken, as you may have seen on stage or TV. It's basically very deeply relaxing, and the more you learn it, the more you realize it's a valuable technique. Athletes use it all the time. They talk about being in the zone when they need to run a race, which means basically they fix their attention on what they have to do at that particular moment. They don't worry about anything else. They don't get depressed about it. They don't get anxious about it. They just deal with the challenge that's in front of them. So that's all part of the mental training that somebody like me would help people to achieve.
That's very good, Graham. And as we know, this is hypnotherapy is non-medicinal treatment, and to improve your anxiety or fear or sleeping disorder. Now, sleeping disorder is one of these big symptoms within mental health issue. Whether you got mental health problem like 9 out of 10, or you scored like 3 out of 10. But everyone from scoring from 1 to 10, the big problem is sleeping disorder. Now, we notice from the prescription, people who are suffering with the mental health problem, is one of these medicine they are getting every day is for help with the sleep. Now, this sleeping pill on the prescription, doctor are prescribing very carefully because of the side effect and all other issues affecting your heart as well. And also this medicine is being used by elderly people or by people who has some other medical condition. Now, from your conversation and also the last event, I noticed you are focusing on the sleeping disorder. Which I think as a pharmacist is one of these key points we can help with. Now, how you can explain it, how you can improve your sleeping disorder, people who cannot get enough sleep?
Sure.
Thank you.
Well, what happens with insomnia is I kind of explain it to clients thus, I say that a lot of people will go to bed and they'll stare at the ceiling and they'll go, oh, I never sleep tonight. And of course, when they say I never sleep tonight, they've just programmed themselves not to sleep because their unconscious goes, oh, you want me to keep you awake? Okay, I'll all those mistakes you made during the day, I'll bring those up, and I'll bring up all the awful things that happened in your past, traumatic incidents, or that horrible bully used to chase me around the schoolyard. And you think, why on earth am I thinking about this stuff? I just want to go to sleep. So it's partly about retraining the brain to actually go to sleep, which I do by teaching people a sort of routine, sort of this is how I go to sleep. But again, it's also about drilling down to the root and finding out why it's happening. So that's an important aspect of it as well, is what is driving this lack of sleep, and what is it that we can do about it. So teaching people a sleeping routine is a big chunk of that, which enables them to be able to go to sleep. In fact, the recording that I make them in is also training them to go to sleep, and they often go to sleep when they're listening to it. So one way or another, it's having some sort of effect to help people to get back to sleep.
Thank you, Graham. Now, if possible, in end of this talks or the event, could you show some sort of techniques which can help with the sleeping? So I leave this for the end of this program. Now, something else I'll bring to this table is like due to the COVID-19, all this pandemic around the world, in the UK, everywhere, is many people lost their loved ones, and they have very grief time, very stressful time. Now, where they end up with the medication on the prescription. Now, within hypnotherapy, do you have any techniques or any sort of way people will get help for their griefness and their stressful time?
Yes. Generally, it's not best to dive into that straight away because people do need some time to process the loss of a loved one. They talk in psychotherapy about the 5 stages of grief, anger, denial, and all of that. But it is possible to help people to accept what has happened, to take the good from what they've learned from that person, and to be able to come to terms with it. But as I say, that's not generally something that we would do straight away. we wouldn't. We'd probably need to leave, a couple of months before seeking help with that, and that's when perhaps some antidepressants or something like that, whatever you would prescribe for that, might be helpful. But in a way, it's a bit like putting a band-aid over a festering wound. If you don't rip the plaster off and deal with a festering wound, that's just going to get worse. So it's actually the same with trauma. I deal with people with post-traumatic stress disorder. That's not just soldiers, it's also police people, it's also paramedics. It can be somebody who's been in an awful accident. Post-trauma is generally the repeated actions of trauma happening again and again, which embeds itself, and then people are triggered by all kinds of things which sets them off, and in a way bereavement is related to that. So it's enabling people to deal with that and come to terms with it.
Yeah, that's very good. So people who are suffering with this griefness, please, you can contact to Graham, and his Facebook page up there, and also you can contact to him over the phone or through us through our Woodbridge Road Pharmacy in Lacey Street, and we got very good contact with him. And any help, please contact us, and hopefully he will help you there. So please never think you are on your own. Maybe you lost one of your loved one and you living on your own. You don't have any relatives. So never think you are on your own. So you contact to us. Like, I'll give you one example. One of our patient, both of them quite elderly. They always come to our pharmacy, and one of them, the lady lost her husband. And also the gentleman lost his wife. So out of these two customers, they are very, very good as a good customer to us, and also always we like to talk to them, and always they share their problem, their griefness. Now, once the gentleman lost his wife, so he ran to the pharmacy, and he just told us he's totally lonely, and he doesn't have people to come and see. So we feel very bad about it. That's, I think, we started thinking how we can help some people who live within our community. And that is made us really sympathize to them. So if you are one of those, please never hesitate. Either contact to the pharmacist, Woodbridge Road Pharmacy. You can search in the Google for our contact number, but I still will give our contact number. It's 01473 286 203, and also Graham details are on our Facebook page as well. You can contact to him as well, or you can contact to us for him. We are always there to help within the community. So now, as I said, for the griefness, now within this situation, what's going on due to the COVID-19, and also people are losing their loved one. So did you come across any people came forward to for any sort of help recently?
Yeah, a lot of the people that I've been seeing online recently, which is, just similar to this experience, really, except it's one-to-one, and I work with the individual in each case. A lot of people have found their anxiety has gone through the roof, or their depression has gone through the roof, their stress has gone through the roof. So a lot of people have been contacting me for the various issues that have really been sort of enhanced by being isolated. In some cases, and it's important to mention this as well. I think there have been people, in domestic abuse situations who found themselves sort of locked in with their abusers, which is also not a great thing to be happening. So I've had some contact with people over that kind of thing as well. Being locked in, either on your own or not being able to get out or not being able to contact people is very difficult. I had a client who literally had to go and see their grandparent for the last time. They had to drive over and wave to them through the window, which is the last time they ever saw them. Which is tragic. It's awful. But this is the world that we're living in at the moment. So, I'm here to work with people confidentially. That's important to stress. I'm regulated by the GHSC, the General Hypnotherapy Standards Council, and I'm on the General Hypnotherapy Register, which any hypnotherapist should be, so that we are ethical and responsible in our way that we deal with people's issues, and we always try to work with the person that's in front of us. Not in a sort of generalized way. Although at the end of this, I'll be giving a generalized technique, a little bit of light self-hypnosis, which, by the way, if you're epileptic, you probably shouldn't do, but it's basically a relaxation routine, but it can work very well.
Thank you, Graham. Now, as he talked about this hypnotherapy for the griefness, and also some other thing I just bring to your attention. Now, due to the mental health issue, lots of young people or within any spectrum, age, they're putting weight on. This is one of these big problem with the medicine is on the prescription as a treatment, where people find really difficulties of managing their weight.
Mm-hmm.
Now, do you think in hypnotherapy, do you have any sort of help which will help with the weight management as well?
Yeah, sure. Weight loss management is probably one of the main things that I do, actually. I've got a couple of weight loss clients at the moment. I tend to follow the route of the hypnogastric band, which was in the papers quite a lot a few years back. So it's partly about nutritional advice, good practice. It's also enabling people to be able to follow that and maybe get a little bit of exercise going. But also, again, dealing with what are the underlying issues? Why would somebody be overeating? Are they self-medicating themselves? I'm miserable. I need to sit and eat lots of popcorn while I'm watching the TV. Which isn't probably the best thing all the time. Occasionally it's great, but generally it's zeroing in on what help people need with weight loss to enable them to achieve that.
Very good, Graham. Yes. So this is weight management. That's also you can help those from the pharmacy as well and from the doctor, because people who is on mental health medicine. From my experience in the pharmacy, I rarely seen their medicine going down, but the quantity is going up from one to another. Start with some sort of sleeping problem, then the mental health medicine from one to another doesn't work. Try another one, doesn't work. Then you go multiple treatment with the mental health medication. Then overall, you have psychiatric, antipsychotic medicine as well. Is this treatment for the mental health people is becoming adding from one to another? Then one of this is we already talked about is weight management, because some people are putting weight on because of their stress, because of their depression, and also Graham has mentioned about eating disorder. This is one of these issues in the mental health as well. So it is quite linked. It's like all branched from one to another. You cannot ignore one. And that's why Graham was mentioning beginning of his conversation. Before you go on the treatment, you try to find out what is causing the problem. You trigger on there. do something about it. I think it is, for me as a pharmacist, also I find it's very important to know. And within the prescribing system here as well, where now the treatment is become patient-centered treatment, where you have this option, doctor will get you involved with the system, okay, which medicine may work better and what else you can do for your treatment. So I think this weight management is one of these big problem with the mental health people, because I do get lots of patients with on this mental health medication, and they always come back how they can reduce their weight. They're saying they don't eat enough, they don't eat too much, but still they put the weight on. So
or they eat the wrong thing in some
they eat the wrong thing. So
yeah.
maybe if you contact to Graham about it to help with your eating disorder, you can manage your mental health problem nicely. So I think I would advise from my experience, do something which will help with your mental health at the same time with your weight management. Because once people put the weight on, they become more frustrated. They're becoming more frustrated than being as a mental health patient. So one way they cannot come out from the medication because they need the medicine for functioning. Another, when they put the weight on, they become more anxious and more disoriented. So I think from your point of view, you can help with it, where people need to come and see you. Is right?
Yeah, and another aspect of that, of course, let's not forget, is that if people are too heavy, they're, for instance, putting a lot of stress on the joints. You know, I typify it as being like if I give you a rucksack backwards and back and front, and I filled it up with bricks, you wouldn't want to run about too much. You wouldn't want to climb steps too much because the knees would hurt. You'd feel kind of sweaty and unpleasant, and you know, it then makes doing things like exercising a little more difficult because we're carrying that bit of extra weight, which is putting more stress and strain on the body. Not only on the skeletal system, but also the heart, the lungs, and in some cases, if people are eating some of the wrong things, that can even lead to sort of cancers and things like that, which you know, is not a good place to be in. The other thing I should flag up, Mohammed, which I think is I've also seen quite a lot of late, is people with not just people who smoke and want to give up, but also I've had a number of people who are addicted to various kind of recreational drugs, particularly cocaine, or people who are addicted to things like gambling, you know, or other habits. And those are things that hypnotherapy can help a great deal with, because basically gambling, for instance, you know, anybody who's ever been on a fruit machine, it's a form of hypnosis. You stand in front of it and it flashes lights at you, and the sounds get bigger and louder and more accelerated, and you know, you get more adrenaline buzz, and so it's very easy to get sucked into oh yeah, you know, I'll have another round of that because that's great, and maybe I'll win big next time. But of course that rarely happens. I think somebody typified gambling as being a bit like going on Ipswich football ground with a blindfold, and somebody releases an ant and you drop a pin and hope that you hit it, because if you hit it, you win big.
Yeah, that's very good, Graham, because as you mentioned about the drug addiction, I think this is another big burden on the NHS and also
alcohol
on the
as well.
Yeah, alcohol as well. So what Graham said here, like before you jump into it, and although you are, despite you are in there, if you think you want to come back, if you think you need help, I think you better to speak to Graham about it. The reason is, from my experience, I've seen people who are addicted to heroin or any sort of drug. Then some people come back to get self-help by from the doctor. Then they come with the method and all other things. So they take quite a long time to come out from this habit. Now, Graham, as you said about the addicted people, now from your experience, could you give us some sort of figure, like people who already started on the drugs and they realize they want to come back? So how often they think they can get better and stop taking those drugs or alcohol as well?
Well, it always first starts with recognition. I know a lot of people are big fans of Alcoholics Anonymous. I'm not so much. I think it's important to recognize that you have a problem, but I don't think it's great therapy to stand up and keep saying I am an addict, because although realistically some people do have that struggle for the whole of their life, there are ways of dealing with it that can help. It's good to sit in a room. It's good to discuss. It's good to share with similar people your issues. That is all really, really good, but it's also important to deal with why it's going on. Again, we come back to what's the initial cause of this. Why would somebody think that shooting up with heroin is a great idea? Part of that is that they get the buzz from it, and particularly with cocaine. Cocaine is a drug where people will spend a lot of their life trying to chase that initial high the first time they ever took the drug, because that was so mind-blowing. They think that they can get there again. Unfortunately, they never really quite get there. So that's why doses can become higher and higher and more repeated. I've known one client who was spending 40K a year on the habit.
That's right. I mean, this is one of this big problem within our community as well, and where some people do realize they do need help. Sometimes maybe they're from social isolation, or maybe for their cultural issue, or maybe they're scared of not telling other people. They're not taking the help, and they don't know where they need to go. Now, within the prescribing system here for the addicted people, is that they have to see the doctor, and they put either methadone or the buprenorphine or some other medicine, which help with withdrawal from the heroin. Now, still, I urge people who you think need any help for your drug addiction or alcohol dependence, you could speak to Graham personally, and he will look after you before you go further. So thank you, Graham. And just I'll mention something else. We'll go back to mental health just for a short brief. Now, in the UK, we have 22% people, 22% men are suffering with mental health in comparison to 28% of women. Now, although we have some other analysis about why women are suffering more, and from your point of view, I'd like to know why is that, and how women can get the help from you within your hypnotherapy treatment.
Sorry, I didn't quite understand that, Mohammed.
We find more women are suffering with mental health problem than the men.
Yeah.
So, is there any answer you have from your experience, and how we can deal with it separately?
I would say the majority of my clients are actually female, but anybody who can own up and say I've got an issue and I need some help with it, that's the first step. So actually what I generally do with people is I offer them a free, no strings attached, confidential chat so they can decide whether they want to work with me, whether they think this is what they want to do. They can then make their own mind up whether they think it's valid and useful for them. The worst kind of client is the sort of client who says, I want to stop smoking. So I say, okay, why do you want to stop smoking? They say, well, my doctor told me I should, or my girlfriend told me I should, or my boyfriend told me I should. Because they're not going to be invested in giving up necessarily. It has to start with, I really want to do this, because, then I feel that we can both get on the case and resolve it, because it is a joint venture. It's not about me pontificating and saying mend your ways and stop doing this. There was a wonderful old Bob Newhart sketch back in the 60s when he was a therapist, and he said, "Oh, I can cure your problem in 2 words." And people say, "Oh my goodness, 2 words, that's brilliant." How the hell do you do that? And he said, "Well, okay, you ready?" And they go, "Yes." And he goes, "Stop it, stop it." And that was his whole thing. Yeah, well, I have a fear of heights. Stop it. And of course that doesn't work like that. And no more than sometimes people think that hypnotherapy or any other kind of talking therapies is some kind of miracle cure. It's not. We don't sort of bash you over there with a rubber hammer and it all goes away. It takes work, and it's all about us working together to realistically, listening and telling me what's going on, so that I can help you address what the issue is.
Yeah, that's very good, Graham, because if I remember last time when you did the event, from my experience with you, now helping a mental health people who have the problem, I think is a big problem with the timing, with the doctors or somebody who are so busy. But what I noticed from the event you did last time, the time you gave to the patient who need help, I think is very important, because you spend quite good time with one-to-one conversation and help out how's the best way to deal with it. And as we know from patient, they said, okay, if a prescriber or somebody who is talk nicely with a smile face, the people just feel better. Their problem, 50% of their problem gone away in the first conversation. Sure. Now, I think from me, what I seen when you did the last one with the dummy, but I'm not sure whether you can show some sort of techniques today. Yeah, I assume you will try, but you need dummy. But the last time when you did those in the event, I think it's quite phenomenal. It's very good and appealing. People will understand. People will share their problem. So when people share their problem, from my experience, is your problem is gone 50% before you get the treatment.
Absolutely. So, yeah.
That's why I believe people who think you are anxious, you are suffering with anxiety or any sort of eating disorder or any sort of medical health, mental health, I would encourage them to contact you, at least to see, because your treatment, hypnotherapy, is quite similar to cognitive behavior therapy. And cognitive behavior therapy somehow is also evidenced is work better than some of those antidepressant medicine who's been prescribed on the prescription, because that is doctor can do. When they come, when the patient come to the doctors after quick assessment, is this only they can do within their short time. Now,
I was going to say they have about 10 minutes, don't they? A 10-minute slot. Whereas fortunately for me, I can spend an hour or 90 minutes just talking to people, and they think, why isn't he getting to the hypnotherapy bit? Well, actually, a lot of the treatment's going on already. You know, we're doing 50% of the work in the time that we're talking. So I'm helping people to examine and reframe, look again at what's happening, and then the treatment comes out of that. So you know, I'm very much evolving as I go along what it is that I need to do with them in hypnosis. Hypnosis, we said, is just deeply relaxing. It just enables us to get to the unconscious a little more easily, rather than the conscious mind going in and saying, no, you know, whenever we get anxious, we smoke a cigarette.
Yeah.
We stomp around and get angry. No, you know, it's a question of we've just got to learn to understand the patterns of what's going on, and how we can in the assessment of that, what it is that we can do that will alleviate that, and most important, put in place some substitute behavior, because if we don't do that, then people are going to go, well, where's my nice habit gone that used to sustain me? You know, what am I putting in place? So we have to find some way of addressing that too.
Yeah, I think it is very important, because even in the pharmacy, when we see people are anxious, when our staff or ourselves speak to those customer nicely, they feel better, and they come back and say, that was great. I think this is one of these key point in the mental health treatment, where the cognitive behavior therapy would help, but the treatment as a medicine, what is on the market, on the prescription, like sertraline or citalopram, they do work, but is not really very good evidence that they have been working greatly. So I think people who are suffering with the mental health, they do need some connection with your friends, with your family, and also with the people who can help with you mentally. So I think, Graham, that way you did last one, I was really impressed about it. And that's, I think, come back to as nice way, okay, how we can deal with this mental health. So that's very good. Now, the last bit, I'll just to move on from your hypnotherapy. Also, you did mention about the pain relief.
Yeah.
Now, could you just explain a little bit about it? Then we'll go back, and if you can show us how to help with your sleeping, because sleeping disorder is one of these big problems within mental health people, who is scoring 1 to 10. Everyone has this problem. So thank you. I'll just ask you if you just talk about a bit about your pain relief from hypnotherapy. Yeah, thank you.
Sure. Okay. I think I learned most about pain relief. Well, there's a couple of things I should bring up. One was I had a doctor as a client. We were agreeing that most things begin and end in the brain, so including pain. You know, we say in hypnotherapy, pain is a message to let healing begin, and so pain is all about the body telling you that in this specific area I've got an issue, which you know, can be at the bottom of the back or something like that, a lower back problem. The thing that taught me most was I had a senior hematologist came along to see me, and he said, oh, I'm in a dreadful state because you know, even morphine is not dealing with the pain. So I said, okay, so what is the pain like? What does it feel like? He said, well, I feel as if I'm sort of naked standing in an Arctic gale, which is just cutting through me. And I said, so you mean it feels cold, this pain? And he said, yeah. I said, okay, well, I'm going to do a very ancient technique, which is called autonomic healing, which was very insistently, it was all down his left-hand side. He'd had a stroke. No, I should have said that earlier. So effectively, his left arm was just hanging there, not doing anything, and there was an awful lot of pain there. So I put him into a slightly deeper than usual level of hypnosis, and I kept sending warmth down the left hand side, warmth down there, and the notion of pain is a message that healing begin. When healing begins, the pain diminishes, as a kind of message to the unconscious. Also, the other thing that we did was we said, well, the right hand knows perfectly well what it's doing. It knows how to do that. So let's burn some new neurology. Let's try and get that left hand moving. So it took a while. It took, I have to say, it took about 6 weeks, and after about 3 weeks, seeing me once a week, he was going, "Oh, I don't know whether this is working, but there's nothing else, so let's persist." And eventually, he got so that he could get control of the pain by closing his eyes and imagining the warmth going down there, and secondly, he started to get a bit of movement, basic movement going in the left hand side. This is not a miracle. This is just sometimes we need to say to the brain, okay, I got the message. I know there's backache there. I know there's pain in my innards, but could you stop doing that? Can we turn that pain down a little bit and just get the old the healing capability going? Because we all have this remarkable self-healing ability. If, as we all know, if we cut our finger, say a paper cut or something trivial like that, we suddenly think, "Oh, it's that sort of itchy feeling in my finger," and we look down and we go, "Oh, it's bleeding," and we stick our finger in a bath and suck away at it, or we wash it under a tap, and we put a band-aid on it, and after a few days it's healthy, it's scabbed over, and eventually there's a little scar, and then generally, unless it's a severe cut, it's gone. So the body's got a remarkable ability to self-heal. So I'll just give you another quick example, which was Professor Walker, Hull University. He was working with AIDS patients and cancer patients, and he found that 50% that were given all the usual treatment, the chemo, the radiotherapy, the drugs, whatever it was, did less well than the people who also had a kind of guided meditation or hypnosis routine, which was, in some cases, one guy was a Star Wars fan, so he imagined he was flying around his bloodstream in an X-wing, zapping all the nasty old tumor bits and nasties and flushing them out of the system, or imagining that the chemo, was 100 times enhanced and was really doing the work. And they seem to get better quicker. They seem to live longer. They seem to have mainly a lot of that was to do with they had a good attitude towards the disease, which was not that, I've got cancer, that's it. But I'm going to do my damnedest to get well. And that's important. The attitude is important, and it's the same with pain. Again, very, very quick one from the my cases, if you like. I had a gentleman who'd had a very bad abscess, which gave him terrible headaches. He was living in Spain. The Spanish dentist didn't do a very good job. Eventually found a competent dentist who sorted it out and got all the toxicity out, because it was it's revolting. It was quite literally eating his jaw, this abscess. So he got rid of that, but he still had the headaches. He couldn't understand why every day he had a headache. They did physiological tests, they did blood tests, they did MRI scans, they did everything. They said, well, the only thing that's left is psychological, so go and see somebody about that. And so I came to the conclusion that he was actually waking up in the morning and looking for the pain. When he found the pain, he started to turn the pain up. So I did what he must have thought, and I think most people would think was a very stupid thing. I got him to close his eyes, to imagine the pain as a ball of horrible, disgusting coloured energy, and float it out and imagine which way it's spinning, and then stop it and twiddle it in the opposite direction and change it to a calming colour, and then stick it back where he found it in the middle of his forehead, which is where he said he felt the pain. And he went, I said, what's different? He said, oh, the pain's gone. He was nonplussed, but actually all we're doing was we're instructing the unconscious to reverse what it was doing. The funny thing about it was he chose red and yellow as the horrible color and the nice color, and then 3 weeks later he sent me an email, still working, great stuff, but I'm using black and white. I find that so much better. than red and yellow. And I went, fine, I don't care as long as it's working. That's all that matters. So it's all about our perception of pain, really. It's being able to say, yeah, there's the pain, but actually I don't want to suffer that so much as I am at the moment. I could tell you a story about a lady who was dying, who I had to help with pain, but let's not go there.
That's very good, Graham. Now, just a quick, I have to mention with this hypnotherapy, what Graham discussed all this nearly 1 hour. Now, you can see how much help he can do with your problem, mental health problem. And also, within hypnotherapy, he can help you with smoking as well. Because within this COVID-19, people are more 500,000 people are suffering with mental health problem and this depression. Now, as we know, this depression reduces our immunity, and on the other hand, people who are smoking, they're also seriously affected by this COVID-19 infection. So if you need mental health problem, you can speak to Graham. Also, you can ring to our pharmacy, it's Woodbridge Road Pharmacy in Lacey Street, where we can help about get connected to Graham as well, and also help with your stop smoking. So now, Graham, as you mentioned earlier on about the sleeping disorder, this is, I think, one of these queries every day we are facing in the pharmacy. Customer come with their sleeping problem. Now, as you already discussed about this, so is any way you think you can show us the techniques, how we can help ourselves to get a good night's sleep at night? Thank you.
Okay, well, just to start with the obvious things, it's one of the things is about not eating too late, because people, if they have to eat after 6 o'clock, then they're probably going to find 3 or 4 hours later they're still digesting that meal. It takes up to 8 hours for a meal to digest, so that can raise your level of activity, which is one thing that keeps people awake. Drinking alcohol late at night to a great extent in order to go to sleep probably is also not going to help, because 3 or 4 hours later you're going to be dealing with the sugar in the alcohol and processing it, and again that can wake you up. That's the obvious sort of physiological stuff. And we can address that by a last meal of the day. It can be having things that are high in tryptophan and melatonin, which are sleep-inducing chemicals. The naturally high in those are things like chicken and turkey, salad leaves, walnuts, almonds, Brazil nuts. We should all be probably upping the amount that is in our diet anyway. So in part it can be dietary and also behavioral. So it's also about thinking about doing what we call electronic detox. So if you go to bed at 11 o'clock at night, then around about 9 o'clock, stop looking at emails, stop envying your mates who are having a great holiday in some exotic location on Insta or Facebook. Just begin to wind down. So that helps. Apart from that, I teach people a self-hypnosis routine. As I've already indicated, that in and of itself helps, but it's probably not the whole 9 yards, because you have to deal with all the other stuff, the reasons why you're not sleeping as well. But, as I say, one thing is to not eat too late, electronic detox, but also the mental attitude. So when you're lying in bed and you're thinking, this is the time to go to sleep, you say to yourself, this is how I go to sleep. And, when we get to that point, I'll just talk through a routine if you'd like me to do that.
Yeah, please. Thank you.
Okay. So basically the first thing to do is to just take a nice big deep breath, breathing all the way through the body, from the top of the head all the way down to the tips of the toes. Hold it, and then just push it out as if you're pushing the air out through a straw, and try and make the out breath slightly longer than the in breath. And then take another nice, long, slow, deep breath, breathing all the way through the body from the tips of the toes to the top of the head. Hold it, and then again, push the air out, and this time actually close your eyes. And a third nice, long, deep breath, breathing all the way in. Deep belly breath. And then again, releasing the air all the way out. Just notice the way that long, slow, deep breaths relaxes you. Notice how the elongating the out breath helps to relax you. And as you continue to breathe deeply and slowly, just breathe into any areas of tension. So I'd like you to just imagine that there is a little ball of relaxing energy just floating above your head. Just a nice silly little ball of golden or pink or whatever energy that you think might relax you. And it enters into the scalp and it's relaxing the scalp, moving down to the temples and forehead and relaxing there, and down to the eyelids and relaxing them so much you would actually cause tension if you were to open them. If you felt you could open them, then they're probably not relaxed enough yet, so relax them a little more until they stay closed, just for now. And send that relaxation down to the cheeks, down to the jaw, allow a little gap between the teeth to let the jaw relax. Continue to breathe deeply and slowly, moving down between the shoulder blades. We saw a lot of emotional tension there. So just send that relaxation down the neck, down between the shoulder blades. Breathe into any tension you find in the shoulder blades. And as you breathe all the way out, just sending that tension that you found across your shoulders, down your arms and out of your fingertips, as if your fingertips were water taps and you were just sending the water flowing away out of the body, all that tension being removed, and into the chest. And again, releasing and relaxing any tension that you find there. Down to the belly and the lower back. Breathe into that area. Release any tension you have there down to the pelvis, down to the knees, and all the way down to the toes. Just allow all of the tension, stress, and strain to flow out of the body. And as you're relaxing there physically, just begin to relax mentally. I'll count you down 10 steps. At 10 steps will take you to a nice, comfortable, safe, secure space, somewhere where you feel happy, safe, and secure. Ready, here we go, and 10, going deeper and deeper now. 9, deeper and deeper still. 8, and double that, relaxation. 7, deeper and deeper still. 6, really relaxing now. 5, when you reach 1, you'll be in your safe, secure space and very deeply relaxed. 4, and double that. 3, and double that. 2, and double that. All the way down to 1. And then just visualize or imagine or create a space, a place where you feel comfortable, safe, secure. And as you envision yourself in that space, what would you see there? What might you smell? What might you hear? What would you touch? What would it feel like if you had, for instance, sand on your feet? And as you explore all of those sensations in your mind, I'll remain quiet for 10 seconds. And then only imagine as you are resting there so peacefully that you take any thoughts in your mind, because thoughts are there, but you don't have to think them, and you put them in a box or store them somewhere, because those thoughts they're for the day, they're not for now. And you set a time in your mind for when you want to wake, because the body clock's very efficient at waking you at the time you want to wake. And then you begin to float and drift and send yourself deeper and deeper down, floating, drifting down into a very deep, deep, refreshing sleep now. Good, and take those good feelings with you. I'm going to count from 5 to 1. When I do, you come all the way back, and just I hope in having enjoyed that deep relaxation and just beginning to realize how that routine of relaxation can really help just let go of all the stuff of the day. Here we go. And 5, feeling better than you did before. 4, beginning to feel energy returning to the body. 3, as you come back to the room now, feeling energized and ready for any challenges ahead of you. 2, almost all the way back. And 1, when you're ready now, just open your eyes and welcome back.
That's very good. Thank you, Graham. That's fantastic. I think I was about to fall in sleep. That's very good, because sleeping disorder is the biggest problem in people who are having mental health issues.
Sure. I mean, we will be doing 30 minutes of that. So by the end of that, most people are fast asleep. And then, unfortunately, I have to end my recording and then wake them up.
So hopefully you have been there to sleep as well.
I've had two clients recently who, I was watching them on their mobile and thinking, nope, they were firmly asleep. So I just had to ring off because they were.
I think that's very good. That's very good. And also people really don't need to come to your chamber. They can do it from home. And
they can do it remotely. Yeah,
remotely.
I've at the moment I'm seeing people on WhatsApp. I'm seeing people on FaceTime. I'm seeing people on Zoom, on Skype. There are endless sort of video platforms out there, and they all work. So it's no problem. And most people will have headphones on, like I have, so that I'm right in their ear. So there's no disturbance.
So you can see people are sleeping, and you just disconnect yourself from Skype or the Zoom or the Facebook.
It's happened.
Yes, that's happened. I think this is fantastic. That is fantastic. The reason is, as a pharmacist, as I know, we do believe more in the medicine. Now, I think it's coming to the time when people are looking for a alternative therapy, which will help with our mental health, not some other problem, without any side effect. Now, as medicine, we know they do have side effect. We know some of this medicine works than others, and not all medicine work for everybody. But I think from your therapy, where you don't have any medicine, you apply no side effect at all, and people are getting the benefit. So I think it's becoming more popular in Western world at the moment. Not only this hypnotherapy, cognitive behavior therapy, some other therapy out there as well. And also, very interestingly, I really like when you mention about the diet. Now, people who are suffering with the sleeping disorder, you do suggest, have your meal, the nice meal, which detox. So it means, as within our medical term, we also say as well, when you think you like to have a good sleep, try to avoid all this fatty food, fried, and have your meal at least 2 hours before you go to bed. And that's you mentioned as well, 3 hours, I think. And also have salads which got less carbo, less energy. So I think it is very important, and is also getting a good foundation. Within the.
I was going to say, a salad leaves are absolutely chock full of tryptophan, which is also found in warm milk. They used to say warm milk sent you off to sleep. It does. Tryptophan is a sleep-inducing chemical. So if you're eating turkey and salad leaves, that's going to help. And nuts and seeds, it's going to help.
No, that's,
Food is medicine. That was the other thing I was going to say.
Yeah, I think it is. It is a belief. Some people, and myself, I say, food is help you to live, and food is there to kill you as well if you cannot pick up the right food for you. So I think it's I do accept, and as Isaiah said, we did medicinal studies, all other thing, but still personally I do believe is food and your behavioral things, what you do every day, it's very important for a good night's sleep, for our well-being. So that's why I thought, okay, you would help some patient who is watching and also who coming to our pharmacy, who will get some sort of advice and take those in their action. So it's very much, I would say, thank you very much. And thanks for joining. And people who is watching, thank you for your time. This is our first program. And as I said, the mental health not is part of our daily, not part of our pharmacy's job. But when I see people are coming to the pharmacy for medication, for depression, for anxiety, all sort of medicine, and over time, same people are coming with more medicine rather than cutting down of their medication. So it's just telling me, okay, let's help some people out there who will get help without medication or with medication. So that is first program we tried. I don't know how much we get success from it, but at least some people out there will get some sort of information for their well-being, and also the program will be on our pharmacy Facebook page, also on our YouTube, and our YouTube channel name is Your Health and Motivation. So that is a personal view. I think our motivation is to bring good health for us. So let's try. If you try together, we can make better. As I said earlier on, 1 in every 4 people are suffering with some sort of health, mental health problem.
And can I just quickly say on top of that, and there is absolutely no shame in seeking help for that.
No, that's true. That's true. So as Graham said, and myself as well, it's mental health. If you hide it, you're going to lose too much. So share with somebody who can help you. Share with some professionals who can help you. Never leave it too late. And also take help from your friends, your family. Try to go back to the root who is causing the problem. Let's work on it. I think that way we can make our life much better. So is anything else, Graham, you like to tell to our audience who is out there, and any future plan, how much you can help for them, and also any plan whether you're coming back on the life again? Thank you.
It is important to seek help. You know, the number of people who say, "Oh, you know, finally I've got around to doing something about this," and it can be somebody who's been struggling with something for years and years and years. You know, I had somebody who came to see me with who'd been through dreadful sort of trauma, and she'd been living with it for about 20 years, and I know it takes time to process this stuff. It's sometimes difficult for us to seek help, but it really, I've seen the benefits when people do, and if they come to terms that, you know, I'm not a miracle worker, I work with people, and when we get to a point where it's starting to work for people, it's huge joy. It's very humbling for somebody like me to sort of see somebody turn the corner and begin to realize that they can start a new chapter in life. You know, what I often say to clients is, Brian blessed for his 65th birthday, you know, giant great big actor that he is, well over 6 foot and a big heavy man, they said, "What do you want to do on your 65th birthday?" He said, "I want to climb Everest." And they went, "You're nuts." But the thing is, he set himself that goal, but he wasn't stupid. He did climbing lessons. He climbed a lot. He only went to the first base camp. You know, a friend of mine who's ex-SAS also went to the first base camp. He said, "Believe me, that's no picnic." He said, and I'm more than half his age, and he said, "Nearly killed me." So it's extraordinary what you can do if you really set your mind to set yourself an achievable goal, and then do everything in your power to make it happen.
Yeah, thank you. And thank you very much, Graham, for coming and joining us. Now,
Pleasure.
as I said, this is our first program, and we'll try to go with it. So there are lots of people out there who like to help people who need help. So please contact to us as a mental health nurse or mental health professionals or doctors who can give us a good advice on this life, and will organize the life as often as possible. So as I said before, this is our first program. So we see how much we can do for people for mental health, because it's NHS and now is main agenda at the moment is mental health assistance, where government put some recommendation where they said due to this coronavirus, lots of people having big problem with the mental health, and also they have like a program for 5 years as well. Next 5 years, how can help with these people, because 1 in 4 suffering with the mental health problem is huge impact on our NHS financially, and also all other stuff as well. So within this recommendation, they said that they would help financial safety as well, and also they advise to help with the advice support to the school or health or care services organization, and also to help people who are in the hospital with mental health, and help with their medicine. Now, we can see really how much NS is thinking about your health and our health. So let's get help from people, and let's help each other. So anybody who like to join us on this live video to help other people, please contact us, and you will be very, very welcome and appreciated. So thank you, Graham, for your time again, and have a good evening.
And you.
See you again. Thank you. Goodbye.